Hello, 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 Facebook, YouTube. I'm Dr. Mila Bennett of Adairabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. It's been a minute since I came on to talk about surgery. Hi, Angela. Hi, Ursula. Hi, Erica. For those of you who are on, go ahead and share the video and let people know that I am on. Hi, Kanisha. Did I say that correctly? Kanisha Clements. Hi, Angel. Happy holidays. Y'all, my birthday is coming too. But my birthday is Christmas Eve. Me and Bradley, our birthdays are Christmas Eve, so I'm about to have a birthday too. Hi, Kiala. Hi, Ethel. Hi, Cynthia. Hi, Sandra. So, oh, sweet. Okay, sweet. Hi, Heather. So I wanted to come on. I haven't done this in a while. I'm sorry. I'm going to try to do better. I've had a lot of things happening in the last few months, and I have been not really super inspired to talk because I've been kind of going through like a kind of a spiritual transformation, and I just haven't really had I didn't feel like talking. So I'm back at it. I'm ready to start talking again. So all right, Ursula, I'll talk to you tomorrow. So thank you. My hairstylist is Nina Boss Hair. On Instagram, her page is Nina Boss Hair. And then on Facebook, I think it's her real name, Melissa Connors. So that's my hairstylist. Hey, Kenya. So I wanted to talk about I did a live about this a while ago, but I didn't get to give it the type of attention it really needed because I had somebody else. It was when Carly Red was at my house, and I was supposed to talk about it that night, and she ended up coming over, and it kind of threw off the whole thing. So I want to talk about that now because we're kind of in the prime plastic surgery season. And so I really want people to be safe and have an idea of how to make the best, safest decisions for themselves. Because unfortunately, all the doctors that do some of the surgeries, even, like whether they're supposed to be doing them or not, they're not always doing what's in the best interest of the patient. And if you die, it's too late. So, trust there's a level of trust you have to have in the person you choose to be your surgeon. But I want to kind of equip you with things to help you maybe make the best decision for yourself if the doctor isn't maybe thinking clearly. Because once you're dead, you're dead. And I just don't want people to die. Hey, Erica. Yes, so I see so many posts and stuff, and I don't really say anything. Some of the stuff that I see like bothers me usually is after the fact, people getting blood and using cell savers and all these things and planning to use it before the surgery even happened. And all these things people don't realize, but certain things are kind of an indicator that maybe it's too much surgery. So if basically people want to, understandably so, people want to be able to get all that they need done in one operation. That's one time that you have to recover. You pay the expense one time. One time you're being put to sleep, all that stuff, which sounds good in theory, but it may not always be the best thing in execution. Because if you're getting 4 or 5 procedures done, and they're all procedures that have a fair amount of blood loss associated with them, then this could be something that actually is putting your life in danger by trying to get all the things at the same time. So if you're going into an operation and the thought is that you're going to need blood, you probably need to get less surgery. If My general rule of thumb is I will plan to operate for 4 to 5 hours tops. And if the procedures that you are requesting add up to more than 5 hours of scheduled OR time, then I'm going to, if you want me to do it, it's going to be broken up. It's just, the longer you're under anesthesia, the more risks are associated with the procedure. The more surgery you get, the more blood you lose. The more surgery you get and the longer you're under anesthesia, both things separately, increase your risk for blood clot formation. Blood clots can go to your lungs and kill you. The more procedures you get, the more blood you lose, obviously. And when you hear people dying and they say, oh, they died of cardiac arrest, that's the definition of death, is cardiac arrest. But oftentimes what has happened is a lot of blood has been lost. If you don't have blood in your body, then your heart has nothing to pump. If you don't have blood in your body, then there's no blood to go and feed your heart. It's just, getting too many things at once increases your risk substantially and increases your risk for death. So, I personally am not willing to schedule more than 5 hours of surgery for one person. If it's going to take me, if I know up front that it's likely going to take me more than that, like I'm planning this tummy tuck, which is 3 hours, and I'm planning this breast reduction, which is 3 hours, and they want some lipo on their back and their thighs, all of that stuff, you can't get all of that stuff at the same time because it just takes too long, and that's way too much blood being lost, because you're a human, like you need the blood. So in general, if somebody is telling you, then we need to plan for you to have blood during the surgery for an elective cosmetic procedure that you don't need, you just want, you should not be planning to get blood. You can be prepared in the event you need blood, but it shouldn't be kind of like, yeah, we're going to give you blood because we know you're going to lose this much. If that's the case, then there needs to be a new plan. People kind of downplay the risk associated with blood transfusions. So blood transfusions come with their own set of risks. And so we definitely don't want to be, it's a wonderful life-saving thing. I've received blood. When I had Bradley, I had to get blood. I hemorrhaged down to the point where it was threatening my life, and so I had to get blood. So getting blood is not a bad thing. It's a life-saving thing, but there's still risk associated with it. People can have reactions to the blood. Like literally some people get almost like, it's kind of like the equivalent of an allergic reaction to the blood, and that can kill you. Technically, there's diseases that could be passed through the blood. Although the blood is tested, if the person who donated the blood contracted the disease in a time frame shorter than what it takes for the disease to show up positive in your bloodstream, you can get it. So, I mean, you don't want to just be getting blood all willy-nilly. So for a cosmetic procedure that you don't need, you just want, how about we just break it up into a safe amount of surgeries so that you don't need that? The other thing is getting too many surgeries in one area at a time, like in the event of a tummy tuck and liposuction on your abdomen. There's some surgeons who do that, and it's not wrong necessarily, but it does come with an increased risk of tissue death or necrosis, if you've ever heard that word before, and those types of really bad complications. So you don't want to overdo it trying to make sure it all happens in one operation, because what you could end up with is really bad or deadly complications that you don't necessarily want. So the right answer is, what is good for me? What can I get safely in one operation? So mommy makeovers. Oh, somebody said, have you ever had a mommy makeover? No, I have not had a mommy makeover yet. I've not. I've had liposuction, but that's it. What is a mommy makeover? So a mommy makeover is different for different people. Basically, it's a phrase that means the surgeries you need to restore your body after having children. So for each individual, that might be different stuff. But for the average person, it's usually a belly procedure like a tummy tuck or liposuction, and a breast procedure like an augmentation or a lift or a reduction or something like that. But it could be like arm surgery, thigh lift, back surgery, like, liposuctioning the fat off your back or any of that stuff. So when people are like, how much for a mommy makeover? I have no clue, because I don't know who you are. I haven't seen your body. I don't know what your needs are. This person's mommy makeover might be a breast augmentation and a tummy tuck. This lady's mommy makeover might be liposuction of her abdomen and her arms and a breast lift. It's different. So it's not like a one size fits all. But what I do want you to understand is that what you need to do is not get too many operations at once. If your mommy makeover entails 5 surgeries, then you need to have probably 2 operations. Don't try to force too much done at one time, because it could be like deadly. Oh, thanks, y'all. Y'all so sweet. Many people are utilizing plastic surgery as a weight loss regime. Get closer to your goal or healthy weight prior to surgery. Less liable to be taken. Less time under anesthesia with fast recovery. Correct, Sherry. I'm not sure which way to pronounce it. Plastic surgery is not a weight loss. Is not a weight loss procedure. And when people try to use it for that, it's no good. That's another situation where you can end up losing too much blood. Oh, because here's the thing. So for liposuction, obviously blood is coming through the tubing and into the canister, and you can see it. With procedures like tummy tucks, the skin and fat that's removed, which, it could be 1 pound, it could be 20 pounds. If say somebody has a 10-pound piece of tissue removed from their abdomen, in that tissue, there's blood in it. So not only are you losing the blood that we can see coming up through the suction and on the sponges and stuff like that we use in the OR, but there's blood left in the tissue that was cut away that you can't see, but it's still gone out of your body, and all that blood loss is dangerous. Which is another reason why there's size requirements and stuff like that. You want to treat the body with respect and respect physiology, and the human body requires blood to live. And if you exsanguinate the person doing surgery on them, that is no good. It's no point in looking great if you're dead. Yes, I will do a tummy tuck and back lipo. You are my favorite doctor. You have a wealth of information. I've watched all your videos. You keep it real, and thanks. And tell it like it is. Oh, thank you, Lori. What causes scar tissue? So every person who gets plastic surgery has scar tissue. Every person who gets any kind of surgery, scar tissue is left behind. That's normal. It's how we heal stuff and close off wounds. You can reduce the amount of scar tissue and keep the scar tissue nice and soft and pliable with things like lymphatic massages or massaging the area afterwards, after surgery. Sorry, y'all, it's late. Overdoing the surgery, too much surgery in one area causes excessive scar formation. So then when you hear about people getting really bad fibrosis, which is scar tissue, after liposuction and stuff like that, that's where a lot of aggressive liposuction was done, and there's more damage, and the more damage you have, the more scar that's going to be formed. So I'm just reading comments. Didn't Jolie have a bunch of deaths? Somebody said their BBLs in October 2020 as Jolie. And I'm pretty sure they've had lots of deaths. I would pick a new place. Does fat last with over the muscle BBLs? Okay, good question. So Some of the fat does last with over the muscle BBLs, yes. The reason why fat was being injected into muscles is because more fat does live if you inject it into the muscle. But what's the point if the fat is alive if you're dead? So injecting fat into the muscle increases the risk dramatically for fat embolism. Actually, that's kind of like the sole reason people get fat embolisms is injecting it into the muscle in the case of the BBL. So while, yes, more fat will live if you put it in the muscle, the risk of you dying is too great, so it doesn't matter. Yes, some of the fat lives when you inject it over the muscle. No matter how you inject it or where you inject it, all of the fat will not live, even injected into the muscle. And it's just not worth the risk of you dying to get more fat to survive by injecting it into the muscle. So no to fat injected into your gluteus muscles. No. I'm just reading comments, y'all. Thank you, Alexis. Oh, Shirley Guerrier says skin looks so beautiful. Look, y'all, I got a pimple. Look at that. I get a pimple like once a year. And there it is. I need to put some of my skin purifying mask on there and sleep in it to try to make that thing go away. I'm ready for BBLs to go away. Folks walking around looking like ants. It's usually pretty obvious when someone has one. Girl, you ain't never lied. I'm so tired of that surgery. Right, Erica? Death is permanent. Can pigmentation hinder a healing process like birthmarks? I totally don't understand that question. Tashika, can you rephrase it? Because I don't understand what you mean. Thank you, Lori. Thanks, Lori. Yeah, I know I'm still beautiful, girl, but that pimple's still annoying. The most annoying thing about it is that it hurts. But I don't burst pimples because that leaves marks. So I just let it do its thing. I'm going to put some on my skin purifying mask. It popped up today. It did all of that today. I haven't been taking my CBD this weekend. Maybe that's what happened. I was going through withdrawals. BBLs can look natural. Yes, they can. But a lot of them don't. People aren't going for the natural look when they get them. That's the problem. Yes, I do chin lipo while people are awake. Absolutely. Congratulations, Brittany. She said was supposed to have surgery with you this month, but of course I got pregnant. Can't wait to reschedule. Yes, congratulations, love. And then you can have your mommy makeover after the baby. Okay, Taishika said, I had a reduction with my birthmark is on my whole left side, and that boob didn't heal correctly, and I had to get a skin graft. The surgeon said it was because of my birthmark. Is that true? I'm not sure. I got to see what that birthmark looked like. I'm not sure. Not sure. Yep, extreme. All right. Well, I guess that's it. Y'all don't have much questions. I'm running out of things to talk about because I've talked about so many things. So I'm like, what? So can you guys do me a favor and put some topics in the comments, and I will go live more about surgery, because I'm kind of like having a brain freeze about surgery. I feel like I've talked about everything. Taishika, don't inbox me a picture because I don't do consults via Facebook. Because that's kind of like opening up the doctor-patient relationship. So I have to have certain guidelines established to protect myself and you. So if you want a second opinion, I'm happy to do that. And in fact, I was thinking I would do like my Black Friday special for that I had for the office. And for the week until Friday, People can book $50 consults. They have to be completed in the month of December, though. So for the last 2 weeks of the month, you can get $50 consults. So if you want a second opinion, I'm happy to do that for you. If you want a consult, go to www.ederabella.com and do a consultation request, and somebody from my office will reach out to you this week. Yes. I'm booking into March, so if you want surgery, like January and February are gone, unless somebody cancels or has to get rescheduled for whatever reason. So if you want surgery with me, like in this season, so that you could be healed and looking fabulous and garment free for the summer, you might want to get on my $50 consult deal. Oh, as long as you book, like, you can hold your spot by putting down a deposit. Somebody say, how long are consults good for if you delay surgery? You can hold your spot by putting out a deposit and also hold your price. So if you want to do a consult and you're like, I'm not, I don't want my surgery till the end of the year or whatever, you can hold your price and, date. And even if you need to change the date, I'm not like, I'll let you change your date once without any kind of fee or anything like that. So, if you want to take advantage of the special, go for it. The website is www.ederabella.com. And my office number is 678-325-0006. All right, everybody. I will talk to y'all later. Bye.